welcome back to the RMS Experience, where we talk about what it's like to be a remote medical staff and also what it's like to work with remote medical staff. Today, we have Alejandro Urich, who is the director of the MSK MSO. Oh, hi, Alejandro. How are you today?
Hi, I'm doing great. Thank you for this opportunity.
We're really glad to have you here today. So tell us a little bit more about yourself.
So I'm a medical doctor. I graduated in Venezuela. I'm 29 years old, and I'm living currently in Germany. But this opportunity basically helped me to grow and to be where I am right now.
And how long have you been working here at the MSK MSO?
So I started 2 years ago, as I mentioned. Well, a little bit more than 2 years ago as a remote medical staff. Then I think at that time we were only two of us working for the company. Then as the time goes and you prove yourself and you notice that you are good at what you're doing and the others also notice that, then slowly but steady I grew up and then I became the director of the MSK MSO.
You had this opportunity to keep growing in the field and on the organization as well.
Yeah, the company provides that to all of us.
That's amazing. So as a director now of the MSK MSO, can you tell us a bit more about the organization, how it works?
Okay, so this company is also brand new, we could say, because they're a company with 20 years of experience. That's not our case, but we have shown to prove that we're good at what we're doing. The company has different branches. We have an education department that it's related to internships, summer internships, also some fellowships, observerships. We also have the branch of the remote medical staff, and that's where I'm working mainly, that we provide services to other practices remotely, of course.
Yeah, and that's the part we want to get here today to talk a little bit more about the RMS services and the RMS department. So can you tell us a bit more about what an RMS is and what pain points do they address in practices?
Okay, so a remote medical staff, we can say it in simple words, there are people that work remotely for medical practices. Most of us, but not all of us, are doctors in our countries. So that brings everyone with a background in medicine, as we are providing services to practices, to medical practices. That's a plus that have more of the most of the remote medical staff. But there are also we have billers, we have people working for authorization, surgery scheduling. So we provide an entire service that it's, let's say, behind the practice. So everything that can be done remotely, we do it.
Oh, that's very important as well, the preparation experience that each of the RMS have. And when you hire this remote medical staff, you can do it like you can hire a whole team. Also, you can also hire, what you need, like the specific task that you need, whether that's if you need specifically billing or if you need specifically someone to the whole, call management. You can do it that way, right?
Correct. Yes. So we provide all services, but of course, each practice have different needs. Some of them need help with phone calls, with proofreading, scribing, some others with billing, authorization. So it depends. We usually have a first meeting with the client and then see what their needs are. After that, then we make a proposal. The good thing about the remote medical staff is that the practices are not hiring a person, but at certain kind of hours. And that's a plus because if that person gets sick, you have someone and you have other people that can and are able to do that job. So that means that you will have coverage every time, even though that person that it's mainly there, it's sick or looking for other things. Yeah, that's all important.
That's very important as well. So Alejandro, what specific services can you hire when working with RMS? And do you have like some sort of divisions between that department, inside the department?
Yeah. Sure. We have several services, starting from answering phone calls. That would be like the clinic division, answering phone calls, scribing, proofreading, authorization. That's another division as well. We have a billing division. We have surgery schedulers. And we also have a social media department. And of course, we start as well with a bookkeeping department. As you can see, the services are basically everything that can be done remotely for a medical practice.
Of course, and as a practice or as a doctor, you can decide which of these services you need, right?
Exactly. So we mainly have a first contact meeting with the provider and with the client. Then we find out what are their needs. Sometimes they don't even know what they need. They just know that they need help. So we guide them through that and we offer them the services we provide. And then they decide. Because, yeah, sometimes they come to us and they tell us, I need more patients or I need help with authorization. But sometimes it's more than that. Sometimes they also have other problems that they are not aware of. And then we point that out and then we offer the services.
Yeah, that's interesting because you walk them through the whole process of understanding what they need and how their practice can improve and be better as well.
Exactly.
So talking about that, what do you think are some of the signs that you as a doctor and having a practice, what are some of the signs to say like, okay, I do need some help with my practice, or I do need, a remote team?
Okay, that's a good question. Sometimes it's quite difficult to differentiate that because the provider think, okay, I'm seeing patients and everything is going normally, but then you have problem with the billing, you are not collecting enough, or you are getting some missed phone calls, or there are problems like you're not getting procedures scheduled. So when you notice that something is not going completely how it should be, then that's the moment when you need help. It might be that you don't know what type of help you need, but that's the point when we enter.
Yeah, of course. And also when you feel like maybe, processes are taking too long, you're missing, some specific things in the practice, that's a good moment, no?
Yeah, and that's something that sadly you don't learn that in med school or while doing residency. So you open your practice and you basically don't really know how to start. So these services are also for new providers, but there are also old providers, like long-time providers, that system changes and the procedure changes, and they sometimes had problems adapting to these new changes.
Yeah, that's nice. Great. So what should a healthcare provider consider hiring an MSK MSO remote medical staff? And what do you think, especially with us, like what are the benefits of working with MSK MSO?
Okay, so the first thing about thinking someone remotely is that it's a remote work, so you don't need a physical space in your office for that person. And the other thing is that most of the clinic department remote medical staff are also doctors, a healthcare provider in their country, so they have a background in medicine. The other thing is that they understand already the US healthcare system. That also, of course, will help in your practice. And there are no hidden fees or extra fees. You only will pay the hourly rate that we agree. And you don't need to worry about payroll, health insurances, or things like that similar. The other thing is that we're an international team. So if you need coverage during your night hours, we have that for you. If you need it like very early in the morning, we have that also for you. So it's an international team, different cultures, different time zones, and all with the same goal, that is to help you.
Yeah, so there are very customized services, as you say, because wherever you need them, we can find the right person to do the job.
Exactly, that's how it is.
So Alejandro, one last question. I want to ask you, what advice would you give doctors that are considering getting a remote medical staff team?
Okay, and I would say that technology is a powerful way to improve your practice and reduce operating costs. So basically, hiring a remote medical staff will help your practice. So give it a try.
That's right. Yeah, totally give it a try. And well, thank you very much, Alejandro, for being here with us today. I really appreciate your insights, and I know they will help a lot other doctors that are looking for ways to improve their practice. So yeah, thank you very much again for being here.
Thank you for your time and for the opportunity.
And thank you all for watching this episode. We'll keep posting new videos, so you just have to check them on our socials and YouTube. So thank you all, and bye. See you next time.